Hey there, healthcare heroes and hypochondriacs. I'm Nurse Jackie. Thanks for joining us on the Nursing Perspective, where we break down weird medical stuff so everyone can understand it. Today's topic, rabies. That's right, the disease that turns cute animals into foam-mouthed zombies. Apparently, dystopia societies weren't terrifying enough. The new movie, The Hunger Games, The Ballad of Songbirds and Snakes, had to add in someone dying of rabies. And what did he get bit by? Our favorite rabies perpetrator, a bat. Yes, really, we've got killer wasps, starvation, and now District 7 tribute, cause of death, bat bite to the neck. Movie rabies might come with special effects, but the real thing, it's all drool, danger, and no glam. Luckily, science has our backs. Rabies is a fatal but preventative viral disease. It can be spread to people and pets through the bites and scratches of an infected animal. In the United States, more than 90% of reported cases of rabies in animals occur in wildlife. Yes, bats are the leading cause of human rabies deaths in the United States, not zombies or Hunger Game scriptwriters. At least 7 out of 10 Americans who die from rabies in the United States are infected by bats. The animals most often found with rabies in the United States include bats is number 1, raccoons, skunks, and foxes. Unfortunately, any mammal can get rabies. While rabid dogs in the United States are uncommon, around the world, domestic dogs are responsible for more than 95% of the estimated 70,000 human deaths that occur each year. Okay, enough about tribute tragedies and rogue raccoons. Let's sink our teeth into the medical meat of rabies. And don't worry, it's less gross than it sounds. Well, kind of. Rabies primarily affects the central nervous system. That's your brain and spinal cord, leading to severe brain disease and death if medical care is not received before symptoms start. Immediate medical attention following suspected rabies exposure is critical. Once symptoms show up, it's almost always fatal. But the good news, it's 100% preventable with prompt treatment, called post-exposure prophylaxis, or PEP. PEP includes wound care, a dose of human rabies immunoglobulin, HRIG, and a series of 4 or 5 rabies vaccines, which must be administered as soon as possible after exposure. This care is vital to prevent the disease from developing. It is nearly 100% effective if administered promptly. It's not fun, but way better than going full Cujo. Each year, 60,000 Americans receive PEP after a potential rabies exposure. The disease is rare in humans in the United States, with fewer than 10 deaths reported each year. Still, rabies poses a serious public health threat because of its high death rate in people. It is also present in many wildlife species. Nearly 3 in 4 Americans live in a community where raccoons, skunks, or foxes carry rabies. You haven't lived as a nurse until you had a panicked patient say, "I might have been licked by a raccoon, but I was kind of asleep when it happened." Like, "Sir, were you camping or hallucinating?" And yes, the new Hunger Games movies might dramatize it a bit. But before you start Googling, can you catch rabies from watching a movie? Let's break down what to do if you are bitten by an animal that could carry rabies. Because as scary as Hollywood makes it, real-life rabies isn't far off. First off, wash any wounds immediately with soap and water for 15 minutes to flush out any virus. Contact your healthcare or public health professional about your risk and if you need rabies-related care. Tell your healthcare provider the type of animal you encountered. Make a note of and tell your healthcare provider if you see any signs that the animal is not acting normally. If the animal that bit you is a pet, ask the owner if the animal is up to date on their rabies vaccination. This information is important when deciding if rabies-related care is necessary. Remember, rabies requires urgent medical attention. Decisions to seek care should not be delayed. You should consult a healthcare provider after a bite from any animal. It could be safe to delay rabies-related care, called post-exposure prophylaxis, while waiting for the result of a test or observation period. However, if the bite is severe, especially near the head, or if it's from a high-risk animal like bat, raccoon, skunks, or foxes, post-exposure prophylaxis should begin right away. If you are able to safely catch the animal, make sure and wear thick gloves and keep the animal alive. If the animal is dead, make sure and keep the head and brain intact and unharmed, as this is what they will test to see if the animal has rabies. After a rabies exposure, the rabies virus must travel to the brain before it can cause symptoms. This time between exposure and the appearance of symptoms is the incubation period, and it may last for weeks to months. Early rabies symptoms can look like the flu, including weakness or discomfort, fever, or a headache. There also may be discomfort, prickling, or an itchy sensation at the site of the bite. These symptoms may last for several days. Usually, severe disease appears within 2 weeks of the first symptoms, when the rabies virus causes brain dysfunction. Common signs include anxiety, confusion, agitation, and hallucinations, including hydrophobia. Yes, it is real, which is characterized by the fear of water and the inability to swallow, according to the CDC. Once clinical signs of rabies appear, the disease is nearly always fatal, and treatment is typically supportive. All right, enough cinematic foaming. Here's the good news. Despite how terrifying it sounds, you can't get rabies from someone just breathing on you. It's not airborne. Rabies is spread when an infected animal, usually wild, bites or scratches other animals or people. The virus is usually carried in saliva or mucus and spreads through broken skin. The best way to avoid rabies in the United States is to keep your distance from wildlife. Never approach injured animals. Instead, contact animal control for assistance when needed. Vaccinate your pets, people. Your Instagram famous dog isn't immune just because he wears bow ties. Pet owners can lower their risk by keeping pets up to date on rabies vaccines. Also, keep your pets away from wild animals and unfamiliar pets as much as possible. Rabies in dogs is still common in many countries outside the United States. So, when traveling, keep your distance from wild animals and dogs with unknown vaccination histories. Rabies might sound like something out of a horror movie, but it's real, serious, and completely preventable. So, if you ever get bitten by a wild animal or your roommate's emotional support raccoon, get help immediately. And Hollywood, if you're listening, maybe next time let a tribute go out from something more realistic, like eating a 3-day-old gas station sushi. Thanks for tuning in to The Nursing Perspective. And don't forget to like, subscribe, and keep your shots up to date. Stay safe, stay smart, and please leave the wildlife alone.